people will be impressed by what it can do for your practice, for your staff, for your patients. I know this sounds kind of corny and funny at the same time, but like it's brought, like Tom and I probably wouldn't have the relationship that we have if it wasn't for SBIRT. We're fond of him, you know what I mean? It brings some staff together that probably wouldn't have communicated as much or on a level that they do. So I think it helps us become a tighter knit staff to better serve the patient. Does that make sense?
Everyone's very excited to have me a part of the program because they feel like it's a big asset for them to have someone, you know, assessing their patients' needs and really caring for their mental health as well as, you know, when they're social, like alcohol and drugs as well.
I think there's a little more communication in terms of what the client needs, sharing of information. So yeah, it's definitely helped us move toward more integration in our services instead of like they do their thing and I do my thing.
It has opened the doors a little bit, a lot. You know, different people I think have different thoughts about that, but it definitely has opened the conversation with behavioral health and medical services being integrated, which is great.
If they know that these questions are coming and they know that they can come here and they can get the help without being judged, and you know, we have resources and they know that, you know, when they're ready for help that we got them, we can do it.
You know, lots of people they have shame associated with their use or their mental health difficulties, and just talking to people about that doesn't uncover a huge can of worms from the provider side, and from the public side it helps people understand that it's okay to talk about these things.
Well, any of our patients coming through for health care are screened by the RNs, and then depending on how they score on the SBIRT, they could be linked. I could be asked to go in to meet with them and offer them services based on the outcome of their screenings. And definitely have seen an increase in our behavioral health numbers being served here as a result of the SBIRT screenings.
A lot of folks that have been hospitalized because of an overdose, and it's an accidental overdose. And you know, when they finally come to and they're medically stable and able to kind of realize the gravity of what just happened, having SBIRT there to talk to them and get them engaged in services right there, having the therapist up in the patient room before they even leave the hospital, and getting everybody linked and getting them comfortable with services, because coming into a facility is very scary, and a lot of these folks have never been into a facility, an outpatient facility. They don't know what it is. It's very stigmatized and they do not want to have anything to do with it. But meeting people that are going to be there and getting the ball rolling ahead of time has really created a lot of success with people coming out of the hospital and getting an appointment and getting started in services and working on getting sober.
The training was definitely beneficial. Before I started, I had no idea what was going to happen. No idea, and I had assumptions of my own about what I was going to be doing that were completely wrong. I didn't know about the specific tools, the motivational interviewing that we were going to be using in the brief interventions. It was definitely really helpful because I had no idea what to expect initially.
Getting to do the motivational interviewing and having to do that on a regular basis, I think has been really helpful for me to develop that area, which is a big area in counseling and in my field and my discipline. So it was a good opportunity for me to practice that a lot.
I think that I've become more confident talking to people in more kind of sensitive areas. I mean, it's hard to talk to a person who has a drug problem, you know, and asking all those personal questions. And I've always loved talking to people, but sometimes you kind of, you know, tiptoe away from those harsh areas. And I've just become more confident talking to people, and, you know, I'm learning things every day about the medical profession as well. I'm learning terminology, I'm learning, you know, everything, like the whole doctor's office, like when a person goes in, the kind of questions doctors ask, how they coordinate their care, you know, all of that stuff. I'm learning stuff about x-rays, you know, I'm learning everything about medical field that I never thought that I would have. So it's really given me knowledge, and I'm excited about it. It makes me want to learn more.
It's given me a new perspective regarding alcohol and drug. Even though I have a LISW, I've just never dealt much with alcohol and drug patients, and it has kind of opened my eyes to the process, what's going on out there, the addiction loop that people get caught up in, and they need help. You know, I'm sure that that first time that they used, in their head they probably thought, oh, I won't get addicted. Just one time, I'm just gonna have some fun. And the next thing they know, they're caught up. And we're all human, we all make mistakes. We need to help them get out of this loop. So it has really opened my eyes to that.
Well, the MI skills are like valuable. I'm taking classes during my master's in social work right now, and actually a whole class dedicated to MI, which is great for me because, you know, my instructor loves me. I can give real-time examples, and but I think for anybody who's in any healthcare profession, those skills are the most valuable you could probably get.
I feel like I've learned a lot about, you know, people's mood, drugs, and alcohol. Coming into it, I was a receptionist for dental, so it was completely different for me. I didn't really know much about any of it. So going in and talking to these people and learning things, you know, they'll say things like, you people have no clue what it's like to be an addict, and I don't. But hearing their stories and things that have happened to them, I've learned so much about addiction and depression and stuff like that.
I feel that it's been a really big education in empathy and being understanding, because a lot of times there's a big stigma against people that use alcohol or drugs, and when you go in, you can't have those assumptions anymore. It's learning that these are people and they have stories and they have reasons why they use, and just listening to what they say, you learn a whole lot about empathy and about understanding people.
I think I definitely have become more qualified to work with people in a broad range of different stuff, as far as, you know, the mood, the drugs, the alcohol. I mean, there's so many, it's a huge spectrum. So to be experienced in talking about all of that stuff and be comfortable with it is probably, I mean, plus you get to help people, so.